to start discussing the history of anatomy heroes, what we call the anatomy legends. You see, in any field of medicine, there must be some other people in the past that have developed that subject. You know, in medicine we have several subjects: anatomy, physiology, biochemistry, you know. And when you go to the clinical side, we have medicine, we have surgery, you know, we have obs and gynae, we have so many aspects of medicine. We have about 19 to 20 something subjects which you people are going to study. So in any of this field, there are legends initially who developed you know, that field per se. So in anatomy, actually, there is no way one can discuss anatomy without discussing the first hero in medicine. That hero was referred to as Hippocrates. Hippocrates was a Greek physician. I'm sure you know people from Greece. You know what is Greece? Greece is a country that is far north of, towards the northern pole of the world. And also, the Greece, any person from Greece is called somebody is taken as a Greek, you know. So Greek is just like the language, you know, they are speaking. So Hippocrates was a Greek physician that survived 460 years before the advent or before the coming of Jesus Christ. When you see BC, it means before Christ. That means 460 years before the prophet Jesus came into being. Prophet Jesus came 2022 years ago. You get my point? So you now count 460 years before Jesus was sent by God to this world. Are you now clear? That was when the history of medicine started. That means almost 500 years before Jesus, that was when the history of medicine started. And Hippocrates was the first person that been, you know, accredited or credited with this. He was known for linking diseases to natural causes. What do you mean by this? Hippocrates was such a person that survived like a researcher per se. Researcher in the sense that he was just monitoring the weather, maybe cold weather, hot weather, rainy season. You know, in those places in the Western Europe or Eastern Europe, you know, there are certain weathers whereby you have snows. You know, you get it. Here in Africa, we don't have such. So he was just monitoring all the weathers to see what were going on as at that time. Like say during cold season, he was just monitoring people and the animals. How do they survive? What type of diseases affect the human beings? And what type of diseases affecting the animals? And then if that disease affects an animal or a human being, what happens to that person? So he was just monitoring the well-being of the creatures as at that time. You get my point? Then if somebody now fell sick as at that time, he was just trying to use, you know, certain herbs, because that time there were no industries to produce medicine or whatever. They were using all these ordinary herbs that we do have, traditional medication or something like that. So once a person was given such kind of drugs and medication, he was just trying to monitor how that person is going to, you know, get over to the disease or whatever condition affects that person. That was how Hippocrates started, you know, making treatment and diagnosing diseases, and at the same time making prognosis of what is going to happen to that person. What we mean by prognosis is when somebody is sick, so what will be the consequence of that sickness? Is he going to survive or is he going to die? That is what we mean by prognosis. So Hippocrates was able to, you know, monitor all such kind of things. So he was just like behaving like a researcher. In fact, he researched several aspects of, and that is why Hippocrates was considered to be the father of medicine, because he touched several fields of medicine, not only, you know, attributing diseases to natural causes, but also something to do with the human body, which is what we deal with anatomists. And so Hippocrates, you know, because of this, and because of his own long history of, you know, taking part in, you know, treating and diagnosing people, That is why actually the oath that doctors do take once they graduate is named after him. So when you now graduate as medical doctors at the end of your course, you are going to be sworn in. You are going to be initiated into the cult of medical doctors. You get my point? So it's just like a family. When we say a cult, a family. So you are going to be, initiated into the family of medical doctors. So we are going to, bring you inside our own club. And so before you are being brought into the club, you have to be sworn in that you are going to abide by the rules and regulation, that your brothers and sisters are your patient are your brothers and sisters, you get it, and your colleagues are your brothers and sisters, so on and so forth. So that oath that you are going to swear is named after Hippocrates, and that is what we call Hippocratic oath. We call it what? Hippocratic oath. And this oath is being done worldwide. Any doctor you see in the world, right from thousands of years back to date, he must have sworn in with this Hippocratic oath. You get my point? And so you too are going to have that, and that is one of the most important legends of the history of anatomy. The second person following Hippocrates is what we call Aristotle. Aristotle also was from Greece. So he was a Greek zoologist. I'm sure you know what is zoology in your biology. Somebody who studies animals. And that is what we call a zoologist. Somebody who studies anatomy, we call him an anatomist. So like myself now, I'm an anatomist. So Anas is an anatomist. Are you clear? So somebody that reads anatomy or studies anatomy is an anatomist. And so Aristotle, he read or he studied animals. And that is why he was termed as zoologist. But don't be taken away because we called him a zoologist. Somebody that deals with animals also must have dealt with human beings, because human beings are also animals. You get my point? We are just like a complex animal, so to say. And so it's like Aristotle dealt with animals as well as the human beings, but he was more towards studying animals. Aristotle survived during the era of Hippocrates, because if you look at this, Hippocrates now came 460 before Christ. This one came 384, before Christ. So it's like there was a little bit of gap between Hippocrates and Aristotle, but then they survived before the coming of Jesus Christ. Are you clear? So he came 384 BC, and his major work in anatomy was what made him the father of, embryology, so to say. Aristotle decided to talk or to work on the development of the heart. Heart embryology, that was what, or heart development, that was what Aristotle now studied. So he was the one that described how the heart, human heart, developed. He was also the one that described the great vessels and veins. The heart itself has some great vessels, the aorta and greater vessels, like the subclavian arteries and other arteries in the whole human body. So he was the one that, after describing how the heart developed, he also described arteries and veins. And he also, named our great vessel, what we call the aorta itself. The major great vessels of the heart is the aorta. And he was the person that named that biggest vessel of the heart. That is the aorta. And so actually Aristotle is considered to be the father of embryology, because he was the first person to describe the development of the heart. And unfortunately, Aristotle, he mistakenly took heart as the seat of intelligence. Initially, actually, there was a thought that not brain, nobody even think of something is inside our head. That is the brain. So they are all thinking that heart is the organ that we use in thinking, making judgment, in making so many things like that. You get my point? But later on, other scientists decided to make some research and find out what is actually the seat of intelligence, which we are going to see who is that hero or the legend that describe the area of intelligence. So the next person who is also among the most important legends or heroes of anatomy is what we call Herophilus. Herophilus was also a Greek scientist. So you see, most of the scientists all over the world, be it in physics, chemistry, biology, in medicine, in philosophy, in so many aspects of education and life, most of those scientists, they came from Greece. You get my point. So actually we can say that it was probably formerly the seat of knowledge. But after, most of the warriors in those places, like the person we call Alexander the Great, I'm sure you must have read about Alexander the Great. He was a warrior that tried to capture other part of the world, like the Asian cities and other African countries, especially the Egypt. So Alexander the Great, came and established Alexandria in Egypt. I'm sure you must have heard about Alexandria in Egypt. You get my point? So Alexandria in Egypt was a city established by the Alexander the Great. And so some of the scientists from the Greek side, they started migrating. And that was how Herophilus decided to also migrate from Greek to Alexandria in Egypt. You get my point? So Herophilus is considered to be the father of anatomy in general. Why? Because he was the first person who started dissection, whether in the living body or in the dead person. I'm sure when you hear the word dissection in the living person, it's surgery. When somebody is sick, he goes to the doctor, and the doctor will now cut him open and then see what is going on inside his body. Like somebody has a heart problem, the surgeon will open the heart, chest, and then see the heart and see what is going on and treat that person. So if somebody has a problem in the abdomen, the doctor will cut the abdomen and now enter inside and see what is going on and then treat and then close it up. And that is dissection in the living body. Previously, they are also doing something like that. But then that time, there was nothing like anesthesia. Drugs that you can give somebody, inject into the person, so that that person will not feel the pain. Now, if I use knife to cut any one of you, you will feel pain. You start shouting. Are you clear? But if I now get an injection that will kill the pain, if I now give you the injection and I use a knife, I can even cut off your hand, you will never feel it. It has reached the extent that nowadays we can cut any part of your body while you are seeing the doctor, even smiling, chatting with your handset, Facebooking or doing WhatsApp while the doctor is operating on you in the theater. So this is as a result of the anesthetic agent. But previously, Herophilus, because that time there was nothing like that, they were just trying to study human beings and whatever. They will catch those people who were criminals when they are being condemned, like somebody who is condemned. This issue of condemning somebody, when somebody now kills somebody, this judgment, if you kill somebody, you also be killed. You get my point? This is our own religion, right? Even in the past, they do something like that. So those people that were condemned because they did one crime or another, it is such kind of people that they were given to Herophilus and co to cut and learn anatomy. So they were using those people, and then they now makes them feel the pain. That is a sort of punishment, so to say. Are you clear? So they started learning, anatomy in those kind of people, and also dead people after dying. Even in the past, people were volunteering to give their own body as a donation, and people study anatomy with them. Here in the current years, in the modern day of anatomy, if you go to Europe, like UK, US, people, they feel pride to say, after I die, I donate my body to anatomy department for them to do the practical with me. But unfortunately here, maybe in Africa, because we are Muslims, maybe because of our culture and whatever, people don't do that. Are you clear? But I think actually ulama should come into this, to start preaching to our own people, so that when you die, you shouldn't be wasted. Bring your body to anatomy so that we dissect you and learn anatomy very well. Are you clear? I think it is going to be Sadaqatan Jariyah. I'm telling you, it's going to be Sadaqatan Jariyah. You just write a will that when you die, your parents should take you to anatomy department so that Anas and his associates should dissect your body to learn more about anatomy. And so, because of Herophilus was the person that started this dissection both on the living and on the dead, he is being described as the father of anatomy. He was even the person that dissected and described brain. You see brain, that's what we call small brain and the large brain. So Herophilus described the brain, both the large and the small brain, and after describing it, he was also the same person that described or discovered that some of the branches of this brain, they carry information from below up. Some they also bring information from above down. And that is the principle of motor and sensory nerves. So Herophilus was the person that described nerves as either sensory or motor nerves. So you see, actually, apart from Herophilus being described as the father of anatomy, I assure you that Herophilus must also be acknowledged or be named as the father of neuroanatomy. So apart from being described as the father of anatomy, Herophilus should also be accredited or called the father of neuroanatomy. Are you clear? So actually, most of the credits in neuroanatomy and also aspect of anatomy go to Herophilus. Apart from this, actually, Herophilus discovered the ovum. You know what is an ovum? Ovum is an organ where the eggs of the woman are produced. So it's like the factory where women eggs are produced. You see, it's like the human body is just like a factory. It's like an industry. There are so many machines inside the human body that they even work better and faster than our modern day machines. You get it? So the ovum itself is an area or an organ where eggs of a woman are being produced, and for the men is the testicles. You get my point? So testes, are the same as the ovum in woman. So we have testes, the men do have testes, and the women do have ova in plural, ovum singular. So the Herophilus was the one that discovered. He discovered, you know what is discovery? To just see something accidentally. So you discover it, like the Mongo Park that discovered the river Niger. I'm sure you know that you must have read the history. So he discovered the ovum in the woman. So now we've seen these three great scientists, they all emanated from Greek. And I told you that Herophilus migrated to where? Alexandria in Egypt. You see, let me tell you something. Apart from Greek being the source of most of the knowledge of the past and the present, Egypt is also second to the seat of knowledge all over the world. If you are talking about Islamic knowledge, Egypt is the seat. If you are also talking about the modern day knowledge, also Egypt is the first. Are you clear? Up to today, Egypt, the university, Alexandria University, and so many other universities in Egypt, you can go to a department and you find about 1,000 lecturers in one department. I'm telling you, millions of collections of books in a single library. That is Egypt. So they have a lot of scientists, great scientists, not only in the field of medicine, in any other field you can think of, apart from being the seat of Islamic knowledge. So wherever you want to find an authentic sheikh or authentic medical doctor, you go to Egypt, you will find them. So they are there in multiples. So we have seen that these three gentlemen, they came from Greece. The next one is what we call Leonardo da Vinci. Leonardo da Vinci was an Italian. Italy, you know Italy actually. They are not far away from the Greece. So Leonardo it was his name. Da Vinci is like from Vinci. Vinci was a town in Italy. Just like you say Anas from Kano. So Anas da Kano. Are you clear? So Leonardo da Vinci. Leonardo from Vinci town. You get my point? So Leonardo was a jack of all trades. But we cannot say master of none. Are you clear? We can say he was jack of all trades because he was a writer. He was known to write several things. He was also an artist, just writing so many things. He was also a painter, so he knew how to paint drawings. Like say you draw a human being, you paint him or her, or you draw an animal and then you paint him. You get it? All these paintings, you get it? So he was a known painter. He was also a musician. You get my point? He was also a musician and he was also an engineer. You get my point? He was also an architect. You get my point? He was also he was also a sculpture person. He was the first person to start sketching human body. Sketching in the sense that he will go and see what other anatomists were doing when they dissect. So after the dissection now, he will try and draw whatever he saw after dissection. So he was just the one that made illustrations. He was the initiator of the illustrations in anatomy. Are you clear? So it's like most of the sketches in anatomy were drawn from the sketches of Leonardo da Vinci. When you go to England, which I was there, I went to one museum, London Gallery, near the Trafalgar Square. When you go there, you will find some of the artistry work of Leonardo da Vinci there. They are there showcased in the gallery of that museum. Even in the British Museum, very large museum along our own university in London, when you go there, you can spend the whole day roaming about inside the museum. You will never finish a section. It can take you more than a week roaming about inside the museum. You may not likely be able to finish with the whole sections in that museum. So even there, you will find some of the work of Leonardo da Vinci there. And so because of these his sketches, he was just trying to make some cross sections of human body by making some sketches. And so that's why he was considered to be the father of cross-sectional anatomy. So he was known to be the father of cross-sectional anatomy. Are you clear? So he had several collections of human body cross-sections. So I told you actually he was from Italy. And so, but this Leonardo da Vinci actually, he survived recently. In that not more than 600 years back that he died. So about 600 to 700 years back, that was when this Leonardo da Vinci survived. You get it? So he's recent when compared to Hippocrates, Aristotle, and the Herophilus. Are you clear? So the next person is what we call Vesalius. Vesalius actually is also an anatomist, but he was from Belgium, Brussels. So Brussels actually, that is where most of our world leaders meet. You get my point? All this United Nations and what have you, and most of these world leaders and European Union, they tend to meet in Brussels. I'm sure you must have known that. So Vesalius actually wrote a lot in anatomy. He had about 7 volumes of books written regarding anatomy. And so actually Vesalius was considered to be the father of modern anatomy because most of the books that we are reading today, they were as a result of the writings, like modernization or edition of the Vesalius himself. So the other person is what we call Malpighi. He was also an Italian. Malpighi actually discovered several things, like Malpighi on corpuscles in the kidney, You get my point? He was the person that discovered that, and the organ was named after him. And he was also the one that, tried to examine the tissue, examine the organs at the tissue level. And so that is why he's being considered as the father of anatomy. I think people should get to know only these six people as you are level 100 now, because if you say you are going to study all the heroes in medicine and anatomy in this your 100 level, you are going to confuse yourself. So I urge you people to actually concentrate on this only 6 heroes. If you know them, that is all. And I'm sure they will stick into your head. When you go further into level 2, probably you may get to know others. You get my point? Don't worry, history is written every now and then. In the next 1,000 years to come, these people are gone. Probably they will be talking about Anas and Megeri and other people like that. You get my point? So that is the way it is. So I think we should have to make a break here.